Hello once again and welcome to Clinic Annex with Dr. Abosede Adigbite. I am a consultant family physician and today we will be talking about alcohol use. What is moderation when it comes to the intake of alcohol? I will be talking from the perspective of a healthcare professional and not from religious perspective. So I won't be telling you what the holy books say, but I want to tell you what modern science calls moderation, as I promised you in one of my videos. If you are a teetotaler who doesn't take alcohol at all, or your religion does not permit the use of alcohol, please watch this video for head knowledge alone. But if you use alcohol, please watch this video for your own safety. Let me tease your brain with one of the definitions of alcohol that I found. It is defined as a toxic, psychoactive substance with tendency for dependence. That speaks volumes, right? Toxic, psychoactive, tendency for dependence. That should modify the behavior of a lot of people that take alcohol. Alcoholic drinks are different in their concentrations. They range from about 5% to 50% in their concentration. Now, it is said that women are allowed to drink up to 1 to 2 units of alcohol per day, and men are allowed to use up to 3 units of alcohol per day. So how do you know how many units is contained in your drink? It is by calculating it. And the formula is the percentage of the alcohol content multiplied by the volume of the drink divided by 1000. That gives you the number of units in a particular drink. Let us start with this beer. This beer has 5% concentration and it is 600 mils. Multiply that, it gives us 3000. Divide by 1000, it gives us 3. That is 3 units. What that means is that 3 units of alcohol is contained in this beer. A man cannot do more than 1 bottle in a day. That is the meaning. You cannot drink more than a bottle per day as a man. And a woman shouldn't drink more than 2/3 of that bottle. So if you're a woman and you choose to drink that beer, then you should share it with somebody, or you drink 2/3 and leave the rest. Let's go to wine. Red wine also differs in their concentrations. Of course, the common ingredient in all of these drinks is ethanol. It is just the concentration that differs. So for red wine, 7 to 12.5% is what I've seen commonly. But let's work with 12%. If you take red wine that is labeled 12%, then 3 units is contained in 250 mils. As a man, you cannot take more than 250 mils per day. And as a woman, you cannot take more than 170 mils per day. What that means is that as a man, you can take a glass in a day. But as a woman, you can take 2/3 of that glass, 170 mils max in a day. So if it is spirit, what happens? It changes. The volume drops because the concentration is higher. Let us start with stuffs like this. I'm not advocating for people drinking alcohol, but we are just giving knowledge. So this contains 43% and it is 30 mils, meaning that there is 1.3 units of alcohol in this, as small as it is. A woman cannot take more than 1 of that, and a man shouldn't take more than 2 of that in a whole day. Also in this one, I bought them for the purpose of this video. Also in this one, we have 30% and it is 50 mils, meaning that there is 1.5 units of alcohol in this. So a woman cannot take more than 1 per day and a man cannot take more than 2. However, if it is this drink that you are looking at, it is 47% volume. So the volume that you are allowed to take as a man is 60 mils. That is what contains 3 units. That's 2 shots. And as a woman, you cannot take more than 1 shot. Let us talk about palm wine. Palm wine has about 4% alcohol content when it has not fermented, when it is still fresh, meaning that a woman cannot drink more than 500 mils, a pint, and a man cannot drink more than 700 mils in a day of fresh palm wine. But when it ferments, you cannot even take as much as what I've said because the alcohol concentration will increase. So the higher the alcohol concentration or content, the lower the volume you should take. So as someone who drinks alcohol, the very first thing to check is what is the percentage of that alcohol so that you can know how much of it you can take. And like I said, the higher the concentration, the lower the volume you should take. As a general principle, the lower the amount of alcohol you take, the safer for you. Some people say, but I don't take alcohol every day. I am an occasional drinker. Fine. But these occasional drinkers now take 4, 5, 6 bottles per sitting. Binge drinking is a pattern of drinking that increases the toxicity of alcohol on the body organs, including the heart. So this pattern of drinking is discouraged. Another pattern of drinking that is toxic is drinking every day. It is wrong to drink alcohol every day. Maybe when we discuss alcohol use disorder, we will discuss all of those. Who should not take alcohol at all? Pregnant women or those who might be pregnant. There are women who don't know that they are pregnant until months after. 2, 3 months have gone before they know. So if you are married, you are sexually active, you are not using protection, then do not drink alcohol. If you are pregnant, do not drink alcohol. If you are nursing a baby, alcohol is excreted in breast milk. Do not drink alcohol. No amount of drinking is safe for babies. And children shouldn't drink alcohol too. Children that are exposed to alcohol early in life, from age 15 or earlier, have a 4 times risk of developing alcohol use disorder than their peers who start taking alcohol much later in life, from age 21 or older. So don't allow children to take alcohol. Then those that have some medical conditions should not take alcohol at all. For example, those that have diabetes. If you have diabetes and you take alcohol, it is going to make the control of that diabetes more difficult, and it is going to make you have complications earlier. Also, if you have liver disorders, you should avoid the intake of alcohol. Otherwise, you will burden your liver unnecessarily. Another category of persons that should avoid taking alcohol are those that are on medications. If you are on medications, even if it's for a short course, avoid alcohol while taking that medication to avoid drug-alcohol interaction. Now, what of those that should tread cautiously? Let's start with the elderly. The elderly, if they choose to take alcohol, should use it sparingly. And that is because they metabolize alcohol slower than younger people. The second category are those that are overweight or obese, that have issues with weight. They should tread cautiously, and that's because alcohol is high in calories. So if you continue to take alcohol, you might find it difficult to control your weight. Number 3 are those that have family history of alcohol use disorder. So there is an alcoholic in the family who is maybe a first-degree relative, because there is a tendency for genetic predisposition, up to 50%. So if you have an alcoholic in the house as a father or a mother, please avoid, or you may want to be cautious when taking alcohol. And that is why nobody should force anybody to take alcohol. If you offer somebody alcohol and they say no, please understand them and respect their wishes. It is wrong to force alcohol on anybody. Number 4 are those that have a mental health condition. A little alcohol can exacerbate their condition. It can worsen their condition. It can precipitate the condition. So if you have a mental health condition, maybe mania, hypomania, bipolar, depression, you may want to avoid alcohol. What if there is an alcoholic in the family that it is clear that this one has a problem with drinking? They have started neglecting their, responsibilities. They drink every day. They drink to stupor and all that. Well, that is substance use disorder or alcohol use disorder. We will discuss it another day. But if there is any such person, help is available. Ask questions and you will be given direction. And they should seek help as soon as possible. The earlier they seek help, the better for them and the better for their families. Thanks for watching. I hope it helped. Please give us a thumbs up if you like it and share with everybody. Together, let's save lives. Everybody needs to say this. You don't know whom you will be helping if you share it. And put your comments and your questions in the comment section or on the WhatsApp number showing on your screen. I'll make an attempt to answer them. And please subscribe to the channel, turn on notifications so that as soon as a video is uploaded, you will get to see it. Also remember that good health is great wealth. One of the things that we can do to promote good health is moderation. Let moderation be our watchword, whether we are eating, drinking, or doing anything else. I'll see you in my next video, God willing. Until then, please be safe. Bye for now.